Okay, my job title is Paediatric Diabetes Specialist Nurse, and I am responsible for the nursing care of children with diabetes up to the age of 18 within the southern sector of the Western Trust. I've worked in the Western Trust, I believe, since about 2004, which is about 10 years. I started off in A&E, and then I took a wee break and went to Paediatric A&E, and then I came back and I did my children's course, and then went to children's ward, and then from children's ward I became the Paediatric Diabetes Specialist Nurse. Gosh, there is no typical day at work for me. My day is very varied. It very much depends on what's happening. I do have a plan and a structure to my day, and I know that I have appointments with patients or whatever. But sometimes it's answering phones. We would get phone calls from patients for support and for advice. Sometimes it might be going up onto the ward to see a patient on the ward. Sometimes it might be enough to give some advice to staff or to do some training with staff. For example, today I have a patient coming in to be started on an insulin pump. I have another patient that's coming in to be started on a continuous glucose monitor. I'll obviously make some phone calls to follow up patients from clinics. We also do clinics, nurse-led and consultant-led clinics. So it's quite a wide and varied job. The challenge of knowing that you're dealing with people and you're potentially going to be dealing with them for the next 10 or 15 years, well, if I'm still in the job that long. But I suppose the biggest challenges are teenagers, and that sort of going through that teenage angst and going through the sort of rebellion, and then having diabetes on top of that, and they can use their diabetes as I suppose as a weapon and as a rebellion, as a way of rebelling. As if they're trying to find their way in the world, they're trying to become adults and they're not quite there yet. So it can be quite challenging to deal with them, to try and get them to understand that what the things that they need to do for themselves in order to ensure that they live a long and healthy life in the future. So that's probably the biggest challenge of the role.